Hello, everybody. Hassan here, engineer, MBA, and investor. And in today's video, I have a special video with Jimi. I've covered a video on Jimi on the article on BBC News. This was 3 weeks ago. And I finally have Jimi in an interview today on this video. So welcome, Jimi. How are you, sir?
Good. Thank you for having me, Hassan.
Absolutely, Jimi. So Jimi, we were talking before recording, we were talking a little bit about the background and everything. And before I started asking about how you're feeling today and so on, I definitely want to talk about the past. And I want to talk about how you got to the point where you are today. So maybe if you could just give our viewers, especially people who haven't really watched the previous video on the article or read the article on BBC News, if you want to just give us a quick background on who you are, where you come from, what was your history like, and to the point in 2019, 2020, where you got to that point, how did it go? And just as a high level, if you could just give us a background for all of our viewers.
Absolutely. I'll make this short because that is long, if I go into detail, but like you said, high level. So I'll get into it. So I was born here in the US, actually, because of sickle cell. My parents are Nigerian, and at the time, 1985, they didn't have that test you do to see what genetic disease your child might have in West Africa at the time. So I was fortunate enough to have parents to fly my dad flew my mom over to the US here to have that test. And indeed, they confirmed I was going to have sickle cell. I'm in the US as a kid. Eventually ended up going back to Nigeria, spent my childhood there. So I experienced sickle cell in almost 2 different continents, and I remember in Nigeria just having pain crises and not having the access to medication. In hindsight, looking back now, the stuff we have here in the US to help alleviate my pain. Yeah, at some point I wanted to come and take advantage of my American citizenship. So my parents pushed me to come back, go to school here. So fortunately, my aunt lived in New Jersey at the time. So I came back 10th grade, I think. I came back and started school, and I really started getting sick again. I feel like as a kid, sickle cell was easier because you're a kid, and the older you get, the more intense the pain and the crises and the complications become. Obviously, because as you're maturing, you have a lot more responsibilities, a lot more stress, a lot more things heavy on your shoulders that can potentially put you into crisis. So I remember living in New Jersey, having to I had this thing called a chronic note in high school where I could call out whenever I want if I had a crisis or anything. I made it through high school, had some good friends, but it was not until I became older and started going to college that my crises started to really, really impact my quality of life. I met my wife now at the time at Rutgers University. We ended up moving together, getting an apartment, and I was just getting sick a lot. It was like a revolving door in and out of the hospital, particularly in the winters. The winters were horrible. I had a heart attack. I had a pulmonary embolism. Multiple ICU admissions, multiple times I almost died, that I made it through. But at one point we just decided that, hey, listen, we really got to improve your quality of life here, and maybe we should get you out of New Jersey and get you into a weather that's a lot more conducive. So that's why we ended up moving to Atlanta. And Atlanta definitely helped. Moving down here, the weather was better. Also, another thing that helped improve my quality of life before the transplant was just changing my mindset. I remember as a kid or young man or teenager, I had a pretty dark mindset, which sickle cell can create. You think you're going to die very soon, so what's the point of being positive? But I remember once I moved down here and I switched up my mindset, I became a lot more positive, and I think actually my positivity actually drew me to this experience that I had with CRISPR and gene editing. I remember one day I have an alert, a Gmail alert that anything sickle cell related comes to my inbox. And I saw the article on Victoria Gray, the first person that gene editing functionally cured her sickle cell. We can't use that word cure, like I said in our tweet exchange, but made her feel a lot better. And I was like, I want this. I saw her story. I've always wanted to be a parent, and seeing how the gene editing had transformed her life, and she could, experience being the parent that she wanted to be. I instantly wanted that, and I reached out to the team that had done her transplant. And the next day, they reached back out. In a few months' time, they flew me out to Nashville where the trial occurred. They qualified me. I qualified, and the rest, as they say, is history.
So just a few points there, Jimmy. You talked about pain. Can you elaborate on like pain? Like what type of pain did you have? Like besides like a heart attack is a big one, obviously, but like can you just go through like the daily lifestyle pain? Because I think a lot of us we're completely disconnected from this type of world, right? It's not that we don't sympathize, not at all. It's just that we don't really. Some of us don't really have, one, that pain, and two, maybe we don't really have relatives with such pain.
Absolutely, yeah.
So if you could just expand on that.
Yeah, and to be fair, it's completely fine because people, it's life. People have so many other things of their own going on. It's hard for them to understand. That's why it's good to tell stories like this. Daily pain. So it's so hard to explain the types of pain you go through with sickle cell. You first you have that baseline pain. That you're constantly in pain, like morning to night, you're in pain, that you need strong narcotic medications to help alleviate your pain. I'm talking about morphine, oxy, Dilaudid, and not just orally, intravenously as well. That's how bad it could get. So you always have that base level of pain that you're always working with sickle cell. And then you have the emergency ones that are called crises that almost sometimes, and this might sound dark, that you want to take your life in order to stop that pain. And like, it's so painful that you think it's the only way you can think, I want to stop this pain, is to stop living. So that's why, you rush to the hospital for those types of crises pain, and they, hook you up to some IV, give you fluids and give you some pain medication. So yeah, the disease is, the cornerstone of the disease is pretty much intense pain. Yes, your organs are going to get destroyed, unfortunately, with the disease, because you don't have any red blood cells pumping oxygen to your heart, to your liver, to your spleen. So your organs are taking a huge hit, but most of the challenges you're going to face with sickle cell is going to come from the pain, as well as also your organs. And also it also destroys your joints. I have a disease called avascular necrosis, which is the tissue or the bone around my hip joints have because of the lack of oxygen and blood to it, they've kind of grinded on themselves. So even the transplant can't help fix that. It will most likely have to be a hip replacement.
And I saw that mention actually on the article on BBC. I definitely saw that mention about hip replacement. But going back to the pain part, you did mention about like dark mindset. And you asked yourself a couple of times, like, what is the point of being positive? Like who were, like, just out of curiosity, who were like the couple of players in your life that were like trying to lift you up? I'm sure there was like individuals, maybe a family member, maybe your parents, obviously, maybe someone like who would you credit the most? Because you can't just go through this alone, right? You need to have a social support, right?
Absolutely. I think I got really fortunate with the person I ended up marrying. I'll credit her with actually changing my mindset. I remember actually one time I was living in Nigeria at the time. I actually had to take a break. I was getting so sick here a lot, and my parents were like, just come home and rest for a while. Let's take care of you. This was in 2006. And when I wanted to go back, the doctor told my parents that if I go back, I'll die before 20. I ended up going back, obviously. My wife really changed my mindset. I'll give it that. Yes, and family members as a whole, my mom as well. Like I told you, she's a very spiritual, faith-based lady. She really made me a faith-based man as well, believing there's a higher power and he's here protecting me. really embedding myself in religion. So I'll credit those two women for changing my mindset.
And that's a great great point, man. Like the point about social support, especially when you're in this type of situation where you have pain, you have continuous pain, and there is no quote unquote cure available. I think the best thing you could have is the social support, which is what you just mentioned. It's amazing that obviously your wife is that person, and you do have a wife. I mean, and there's so many people out there with diseases that unfortunately either they're like, alone, or maybe they don't have that social support. So I think I definitely want to raise that point, because in this channel, Jimmy, like, I mean, I mentioned that before recording, that we talk about CRISPR companies, we talk about investing, but I've always said something. In fact, one of my early videos, I've always said that it's always about the patients, right? So it's always about the patients, always about how can we quote unquote cure them, right? And this is so important because you are literally a story where we have a patient that is, I mean, it's not quote unquote cured yet, like you mentioned, but it's been successful so far. And you are one of the many stories, hopefully. And that's exactly why I wanted to interview you, right? Because not only you talk about the positive side of things, but also how did you get there, right? And it's so important, like, it's so important talk about social support and talk about awareness, raising education. I mean, we can talk about CRISPR and the genome editing program and so on, but ultimately, for you to get to that point where you had to enable Gmail alerts, like, that's crazy. Like, I don't think, like, honestly, the only time I've used Gmail alerts is just for like travel prices. You know what I mean?
Yeah.
So actually, I'm curious, do you actually always use Gmail alerts for like a bunch of stuff, or?
Not just sickle cell. To be fair, I just wanted to make sure I was informed. I had done my research on gene editing and wanted to make sure I was aware when something came up and I could take advantage of. Also, to jump to your point about support, I feel you're absolutely right. And I've met so many people, not just with sickle cell, but with chronic illnesses, that have not had the level of support I have. So I want to acknowledge my privilege here. I'm a very privileged person. So it's been, I call my, remember that those are Dos Equis commercials where that guy is like the most interesting man in the world. I call myself the luckiest man in the world. I mean, starting with the story of my parents being able to travel here and making me, so I wanted to acknowledge that as well.
Absolutely. Yeah. And I got some questions about Nigeria too, unrelated to all of that, maybe towards the end if we have time. But I do want to ask you, okay, so you enable Gmail alerts and you get to see that news about Victoria Gray, which we've covered in our channel in the past. You get that news and then obviously you reach out and you get to that process. Can you just give us like a timeline, like high level, like when did the first that you said they flew you out? So when was that maybe date approximately? And when, like maybe high level dates, do you have a couple of dates for it just so that we help our viewers
definitely.
with the timeline?
I remember it was around, I think October, I had seen that article and I reached out to them, I think September, October, I think it was most likely October. And they flew me out in November. Actually, I remember my wife was 8 months pregnant at the time, and we had to find an airline that would let her fly that deep into her pregnancy, because you're not supposed to fly when you're that pregnant. The test, it took about 2 days to get all my tests to make sure I qualified. And in December, right before Christmas, they called me and gave me the good news that I had qualified. And then in January of 2020, I went and I started the clinical trial. And I remember, I think we got into March or February, actually, of 2020. And I was number 16 or patient 16. And then the pandemic happens and people can't fly anymore. They actually paused the trial for a few months, if I recall. But they still wanted to continue, and they reached out to me. Hey, listen, man, we have a lot of patients that are not going to be able to continue right now, obviously, because they can't fly. We have people flying in from California, New York, Detroit, all these places. They can't continue because they can fly. But you live in Atlanta, so if you want to continue, it's only a 4-hour drive to Nashville. At the time, we had it wasn't 1 year old yet. We had a newborn baby, actually. It was a few months old. And we just looked at ourselves like, hey, listen, this is going to change my life, which is going to change our lives. And it's going to be tough, but let's do it. So we ended up throughout the whole pandemic in 2020, driving back to Nashville for 4 hours, like, twice or three times a month.
So like obviously right now in hindsight, it's an easy decision, obviously, because where we are today. But at the time, how did you actually feel about the whole drive? Like, because it still wasn't clear if this whole treatment was going to be even successful, right? If someone tells me I'm going to do something to my body and nothing's been proven in the past, like FDA approval, I'm not gonna, I'm gonna have my doubts, like, how did you feel at that time, like high level? If you just explain how you felt during that time.
Yeah. So in the early parts, after we started driving. I think we started driving in like March, April. We just knew we just had to lace up our bootstrap and just continue this journey. We knew it was going to be difficult having a newborn baby, but we just knew that this was going to change my life. We already, even though we hadn't done the actual gene editing yet, we were just so positive, just putting positive energy out there that this is going to work. This is going to work. We have no choice but to continue. So we're going. It wasn't until the end of the year when I actually had my DNA edited and the CRISPR, which will happen in September. I think September I had chemotherapy to wipe out everything. And in September as well, I ended up getting the new DNA. But the edited DNA, I should say. And I lived in the hospital with my wife and my son for about 30 days. And that's when I'm like, oh my God, what have we gotten ourselves into? My wife was working. My wife works full time. She was working next to me in my hospital bed, taking care of our newborn. I also, before the chemo hit, I could take care of him. So I was taking care of him when I had the energy. And then after the 30 days post-transplant, we had to still stay in Nashville. So they put us up in a hospital apartment where the air is clean and they have all these filters so you don't get sick. So I had to stay another 30 days. I think we ended up staying at the end of the year about 60 to 65 days in Nashville to make sure I recover properly. And they were checking me post-transplant. And then we ended up coming back to Atlanta in December for Christmas. But the hardest part was during the actual transplant from that month in September to November. It was tough because I was on the chemotherapy, which made me extremely weak. We were living in a hospital ward with our newborn baby. And then after that, we had to go live in an apartment, but we couldn't really go out too when we were in this apartment because it was the pandemic. So we were just cooped up in there. I just had chemo. I just had my transplant. So it was tough, but we always tell ourselves, my wife and I, that all situations, just because this is our current situation, doesn't mean this is how it's going to be forever. So we just grinded through it.
So actually, like that you just mentioned, like pandemic, yeah, such a tough year. 2020 was crazy. 2020 and even like 2021 was crazy for many regions. But that's amazing that you were able to see the light in the tunnel, right? Like you were able to see the end, right? At some point, right? Even during those dark, tough times, even after chemotherapy, right? That must have been really, really hard. So let me ask you this then: for people that have those types of, like, obviously not just sickle cell disease, just a disease in general, right? And they're listening to us right now and they're like, okay, so for me to get a treatment, I need to get out there and actually, get involved in the process and the treatment. And obviously it's a long process, right? It's a long process and it's going to take months, years, right? But a lot of people with those types of diseases, maybe looking at that, they're like, you know what, I'm going to take care of it another day. What would you say about that? I know it's a very it's a simple answer to give, but the reality is that a lot of people, and I've heard many stories where people just delay things, right? They delay things, and then things get worse. It's sort of like obesity, right? It's like people that they know they're eating a lot, they know they're not eating the right foods and so on, but they keep doing it. until it gets to a point where there's, no turning back, right? There's no point of return. So what would you say about those types of individuals who are listening today? Like, is there like some sort of advice you have for them? Say, look, like what would you say to them?
That's a tough one, man, because everyone's story is different. And I want to be completely fair to people and what they're going through. For me, the reason why I was able to take action is because I was staring down fatherhood. I did not want to. I always say this when people ask me what sickle cell feels like. Sickle cell is the most demanding companion. I didn't want to share fatherhood with sickle cell. I didn't, and because I knew sickle cell was going to win. Because it takes, and it will continue to take. And we had struggled to get pregnant, actually, my wife and I, for 7 years, and she doesn't mind me sharing this because she wants to be open and let people know that, hey, listen, it's okay to, infertility shouldn't be shrouded in mystery. We can talk about it. So we had struggled for 7 years to get pregnant, and we finally, through the help of science, by the way, through in vitro fertilization, we finally conceived our first son. And I just knew that I wanted to be as present as possible, and I knew sickle cell would not allow me to do that. And I also wanted to be here for him, and I knew sickle cell would potentially not allow me to be here for him. And that's why I was able to take action. So if I should give advice, I would say look for that thing in your life that's most important to you, that you would make you the better person that you will. Because people that are going through things, diseases and obesity, they don't want to be obese. There's something that started it, and there's something that can stop it too as well. The most important thing, if it's a mom or a sister somewhere, I'll just say this is really search. First of all, it's completely fine to take your time, as long as you need it. But once you find that thing that makes you want to reach out and fix whatever ailments you might have, once you find that, hold on to that, and that will drive you. That will give you inspiration.
So, and on top of what you just said, have you found yourself in a situation, because today you've gotten like a lot of media to reach out to you. Obviously your name is out there, and like BBC News and so on. Have you gotten like any messages, any emails, any patients to reach out to you? And obviously I'm not asking for like details specific, but I'm just asking like, how do you feel about that? Like, what's your approach about that? Like, because I'm sure this is gonna blow up as months go by, right? Because you're a success story, right?
Yeah, absolutely. And even pre-transplant, I'd already been, like I said, I used to be an advocate. I'll never call myself an advocate now, because there's so many people that are true advocates that help bring awareness to this disease. But I used to do that quite often in the past as well. And back then, in that past life, when I had sickle cell, people used to reach out to me. But you're right, completely, with all the press and all the media I've been getting, I've been inundated with messages from people just in pain. And not just people in pain. What I'm seeing, most of the trend I'm seeing, is actually parents of children with sickle cell, and they just feel lost. They feel like their hands are tied behind their back and there's nothing they can do. So it's sad. The bulk of the messages I'm getting is coming from Africa, where the disease affects approximately 4 million people, compared to here in the US, where I think it affects 150 to 200,000 people. So it's sad. I try to respond to as many of them as possible. Everyone wants to know how they can get in the trial, and I'd let them know, hey, the trial is full, but they have a line where you can contact, where you can reach if they open it back up. And I just try to give them some hope, and I let them know, yeah, it looks like it's working for me. The goal is to commercialize this as soon as possible. I know it's going through the FDA right now to approve it. So I know it's still a few years down the road, but just hang on. Don't give up.
Yeah, and that's a great word of advice, actually. Like, and this is things that I've actually said a lot in this channel, where I actually repeat many times that there's a lot of people outside the US. You just mentioned Africa, that are in dire need of treatments, right? Not just for sickle cell disease, but sickle cell disease is a big one there. Beta thalassemia as well, beta thalassemia. And obviously CRISPR Therapeutics and Vertex are both collaborating on CTX001 to tackle those two diseases. And I'm really like I've mentioned that in previous videos, in recent videos. I think all eyes are on the program for end of this year. CRISPR Therapeutics CEO has already mentioned that they're planning to file for FDA approval and potentially an FDA approval by 2023, which is gonna be amazing, man. It's gonna be amazing because you just mentioned there's so many people in Africa that are asking you, right? They're asking you directly, like, hey, how can I get a treatment of that? And right now there's, there's nothing, that you can line up, but there's not, you can't just go to your local doctor and just, you know what I mean? This is not that type of treatment. So I'm really excited for that. And then my question to you then on that is, why do you think that there's not that many opportunities right now? Do you think it's just a matter of CRISPR being a new technology, or do you think there are other reasons why we don't have this available in all regions around the world?
Gene editing specifically?
Yeah.
I think it's because it's still so new. It's still new. They have to test it out. I don't mind being the guinea pig, being a pioneer. Knock on wood, nothing will happen. But I think it's because it's still just a new technology that's just emerging. And like we said, in our background chat, real before, like we both agreed, is this arms race where all these companies are trying to bring out their own version of gene editing to help society. So I don't mind it. I know arms race typically has a negative connotation attached to it. But here it's completely positive. So I'm happy.
Absolutely. And I've actually mentioned that as well. And I mean, this is more in the lens of investing, but it's actually a great thing that you have many of these companies like CRISPR Therapeutics, obviously, but also Beam Therapeutics that are sort of tackling sickle cell disease and so on. It's just amazing because you have this one disease and you have a limited amount of treatments, and you have no FDA approved drug, CRISPR therapy at least, to treat those types of disease, in this case, sickle cells. So you want more companies to venture into this space, right?
Exactly.
And it's not just sickle cells, obviously, there's other diseases as well. I mean, we haven't talked about it, but HIV, there was this private company. Exactly. Diabetes, type 1 diabetes. I'm really excited for that one.
Yeah.
We already
saw the press release from Vertex, I think it was last year. I was mind blown.
Yeah. Vertex.
Imagine
I saw that.
making your own insulin. That's so cool.
Yeah. It's amazing because we're entering, and you alluded to that, right? The pandemic was obviously a bad year for the whole world, but there's some positive out of that, right? The silver lining is that, we've gone in more focus on like biotech, right? And genomics, right? There's more focus, not just from the investors, but just like general public, right? The public's like, you know what? We should be taking care of our health. What's going on with cancers? What's going on with disease? I mean, we haven't even talked about cancers yet, but it's just mind-boggling that in 2022, we have nothing to cure cancer, or at least, have a treatment that's available around the world. But clearly, it's not the case right now, right? So it's just crazy.
And what's really cool about these gene editing therapies coming out, like we both said, it can be used for a variety of diseases. But for decades, the sickle cell community or sickle cell disease has been almost at the back of the line. I don't know why this happened, but with gene editing, we're in front of the line. It's so weird. Every company that's coming out with some variant of gene editing, or sickle cell is the first disease they want to try. It's mind-blowing to me for someone who has sickle cell. And I've wondered, hey, why do pharmaceutical companies don't care about me? It's cool to see that they care. So just really awesome.
Yeah, and I really think by the end of this year, early 2023, I think we're gonna move into a new era. I truly believe it. Like I think we're gonna see genome editing / CRISPR enter in this new space where it's no longer just in the labs. It's no longer just limited to like several patients. I truly believe it will be FDA approved. Again, this is just speculation on my end. Obviously, we don't have inside information, and it's not financial advice for sure. But I truly believe it's going to be a new era. So I'm really like all in with, and like I'm sure Jimmy, like you've watched our videos and in our channel and our community, we have individuals that are following this space like Hawkeyes, right?
Yeah.
There's people like they're watching everything.
Keep watching, guys. Keep watching, man. This is just the beginning. That's the crazy thing. This is just the beginning.
Absolutely. This was a great blog article from Intilia CEO today. I don't know if you saw today's video, but he actually wrote Intilia Therapeutic CEO. He wrote the blog article called "Something Big." Right, this is something big. That basically is something big that's going to come. Right, this is all beginning of something big. Right, which is truly a great way to describe it. Right.
Yeah, it is. I mean, imagine everything it can help. So yeah, I'm sure you've seen the documentary Human Nature, right?
Yeah.
Of course. So that even with COVID as well, because COVID is going to be here forever. We can use CRISPR in the future to help prevent or create vaccines, that are matching with our gene. It's crazy. I don't want to go into the science because I'm not a scientist, and I feel like I might say something wrong. But yeah, he's right. This is just the beginning. Something big is coming.
And about the documentary, really quickly. I mean, I remember watching it. Obviously, I don't remember the full documentary.
I watched it in a hospital while I was actually having my transplant. Yeah, and I was like,
oh my
God, I can't believe I'm doing this right now. I was like in bed watching it, and I was shocked.
You just like randomly like browsing to that.
My one of my research doctors came and like, hey, have you heard of Human Nature? I'm like, what's that? Like, what you're doing right now? CRISPR is a documentary on it. So I put it on and I watched it. I was like, I couldn't believe it, And the doctor actually, he keeps reminding me of sometimes, because when you do it, you just forget. He keeps reminding me what I've done, and like one of my appointments, I'm not going to say the doctor's name because I'm not sure if I'm allowed to, but he said, Jimmy, what you've just done is the equivalent of landing on the moon. And my wife and I I think we wrote it down somewhere so we can remember how important this trial is that I just took part in.
Yeah, absolutely. It really is. I think because that question I asked you earlier, like right now, today, in hindsight, it's easy for me to think, okay, yeah, of course, Jimmy signed up for the treatment. Of course, he's going to go there. Like, of course, he's going to drive 4 hours from Atlanta to Nashville, right? Of course, he's going to do that. But that's all in hindsight, right? But at the time, there's no, just think about, we just went through a pandemic. Everyone's freaking out, right? You were still in the pandemic, right? 2020. We were actually midway into the pandemic, and it was like people were freaking out, right? And I'm sure you were freaking out too with your family and friends.
Of course, I'm a very paranoid individual.
Exactly. So you're freaking out, and everybody around you are freaking out, including everything on media. And they're asking you to drive 4 hours to get this treatment, which, I mean, yeah, you read about the Victoria Grace story, but that's just one story, right? I mean, what about, there's no FDA approved CRISPR therapy, this is a huge risk, right? So you're taking the risk to that level. I really believe that, because you're going to be remembered as one of the first few patients that actually took a CRISPR-based therapy before anybody, and that was never FDA approved. And because of that leadership, because of that initiative, you were able to pave a path for future generations to come, right? When it comes to CRISPR, when it comes to genome editing labs, clinical trials. So I agree with that doctor's statement, man. I agree with them.
Yes.
So yeah. So
okay.
I do want to ask you today. I want to ask you. So we talked a little bit the past. We talked a little bit about how those treatments went, high level. Obviously, we won't go into those details about the treatment itself. But I do want to ask you today, how are you feeling today? And you said, you have obviously your family man, your wife, kids. How are you feeling today? Obviously, you're not quote unquote cured, which, I made that mistake with that statement from the last video. But today, how are you feeling? Like, what is your daily routine? How are you going about your days? And if you could share your thoughts on that for our viewers.
Absolutely, yeah. So yeah, by definition, I'm not cured, but boy, it feels like I'm cured. Um, it sure feels like it. My life has changed completely. So before pre-transplant, life was, like I said, I'd already switched my mindset. I actually think switching my mindset is what actually got me into the transplant. So life was not obviously as good as it is now, but I was running my own business at my own pace, because I didn't want to bring on too much stress. I'm sure you know what that feels like. This thing you do here is a business. So you know what the challenges of being an entrepreneur is. So I was running my own business at my own pace, always in pain. I'm in e-commerce, so most likely in December, you're going to have to roll up your sleeves and join your team and get products out the door. And I remember just hurt, like I was going to swear, but hurt bad. It was bad. I'm working, owning a business, having sickle cell. It was tough for me. I remember even flying. I fly to trade shows and to showcase my products. It'll take me 2 weeks to recover from a flight. Can you imagine? I was going to say when I had sickle cell because I still have it, but when the sickle cell was really bad, it would take me 2 weeks. And then after the transplant, literally, I'm actually doing more traveling, not just for work, for press, different things. My business is, I'm able to, put my business into a different gear now. Like I've always wanted to, raising money, doing all the things I've always wanted to. I didn't want to do in the past. I never really wanted to raise money before because I was like, who's going to invest in a guy that might die soon? So doing that, raising money, and then on top of that, I also wanted to go in and get true e-commerce tech experience. And I'm doing that now. I'm working for a pretty cool e-commerce company. I'm consulting for them, doing other consulting things. I'm up at 4:30 in the morning, in bed at 10. Literally nonstop. Like I said, I take multiple flights now. I go to Nashville often as well to continue my ongoing care. So I'm traveling many times in a month, and I'm completely fine. Life is great. I told you when we started the trial, I had one son. After the trial, I wanted more kids. Now we got two more children. We had one set of twins because we could do that through science. Because I told you
Wow,
we did IVF, so we're like, yeah, let's get twins.
that's
So yeah,
amazing.
life is freaking good right now. I got 3 kids under 3, so it's insane. And I'm sure because of when you ask me how come I'm up this early. So just chasing kids around, doing what I wanted to do, work-wise, career is going great. Family is great. My parents are happy that I'm so healthy now. I felt so bad. You don't understand what it's like when you see your child suffer until you have a child. So now that I can empathize with them because I have children now, I'm so glad that I'm giving them some kind of peace of mind knowing that I'm okay.
Absolutely, yeah, and actually, that's a great point you made, Jimmy, because I think this is something that a lot of people in this space, in CRISPR space, I wouldn't say they underrate it. I wouldn't say they don't talk about it. I just don't think it's that important for many investors, right? Because investors, obviously, they're looking at financials, they're looking at the progress, they're looking at data, but then the story of the patient, right? Like now you can operate fully, right? You can spend time with your family.
Exactly.
You can, you just talked about, it took you 2 weeks in those days, 2 weeks to recover from a flight. That's crazy, man. Like, but today,
Yeah.
you can be more productive. You can basically contribute more to society because now you are
Exactly.
in a position where you can be at your best, right? Without worrying about that continuous pain that you previously had, obviously before the whole treatment started. So that's amazing, man. This is something, if I want our viewers for today's video to take away from, it would be that, right? It is the patient is the center stone, right? It is all about the patient, right? It's
Yeah.
all about the patient. I would highly recommend everybody that's in this space, whether you're an investor or not, to always direct back to the patient, right? It's always by the patient, and it's not about the licensed patent. It's not about the companies like, XYZ, whatever the media is covering it. It's really, how is the patient feeling? Is the patient been treated? What is the data looking at for the patient? And then what does the patient have to say, right? And I find it amazing that you can come out and talk about these types of stories. Like I'm sure like the news media, they reached out to you. And what was your reaction first when they reached out to you? Were you a bit surprised or shocked that you got this much coverage? Or were you more like you were sort of expecting this type of coverage?
I wasn't surprised or shocked. I was expecting it. I'd actually reached out to the Vertex team and told them I was interested in telling my story. So they actually were the ones that I should credit for most of the news that is out there on my behalf. Of course, I'd done some things myself in the past as well. Like I said, I used to be an advocate. So I'd done some user-generated stuff and people had reached out in the past. But no, I'm not surprised because it's Vertex. So I'm sure they can get the best press out there. So no surprises here.
Absolutely. So knowing how you are today, I mean, I think obviously I cannot use the word cure, and we should definitely not mention that because you're not quote unquote cured technically, but you are
don't
feeling
want to set the wrong expectation
exactly
for potential patients.
Exactly, but you are feeling better, and things are obviously looking better. At least today, at least for now, up to now. You're spending more time with your family, like I mentioned, you mentioned, and that is just amazing. So how are the conversations with your wife these days, like about all of this? Because this must have been a roller coaster, right? Must have been like a crazy experience. Like it must have been crazy. Like I'm curious, how are the conversations looking like? More positive, more optimistic?
I mean, I can't even touch on how bad it was in the past and how mentally broken. I will admit I have mental health issues because of sickle cell, and most people don't know that there's a physical side to the disease, and because of the physical side, there's a mental side. So my wife has been through so much, and she really took those vows extremely seriously in sickness and in health. She took those extremes. So I'm really grateful. Conversations are great, man. Right now, we are in a mindset of just enjoying life because, boy, we've suffered, both of us. I have to give her a lot of credit. Not many people talk about the stories of the person that is the partner of someone with a chronic illness. They carry a whole load. I mean, she's literally sat next to me watching me die, and all of a sudden, many times thinking this is her last night with me. So conversations now are more on the positive side, like, hey, we want to go watch Liverpool in May, lift the Champions League or something. That's what conversations are. Kid stuff. What should we get the son to daycare now? I'm scared of COVID. I'm like, babe, COVID's gone. Let's get him in daycare. It's not gone, but the risk is low.
It's funny you're mentioning the gone part. I think because I live in Canada, right? And there's I think in the next week they're lifting off the mask and all the mandates next week in Toronto. And I make that joke. I'm saying maybe COVID decided to go away next week, right? Which is funny, but I agree with you. Like, yeah, for sure. Like that's amazing, man. That's a great sure.
Our conversation. Of course, we still talk about sickle cell, and sickle cell will still be part of my life. But not it's not a big cloud over us anymore that it used to be. Like, we can go out, we can travel. We don't, literally everything we did pre-transplant, it was almost like a what's that thing when a third day, it was me, her, and sickle cell. All right, okay, so we're gonna do this. We have to pack all, and now it could just be me and my family without
it's the third wheel. Yeah, the third wheel. But a bad third wheel, obviously, a very bad third wheel. Okay, that's amazing, man. That's I think this is something I got from that article on BBC News when I first covered it, and when I first read it, I was really, really happy. And that's why I reached out to you, right? It's just amazing. It's an amazing story, and I was planning to get at least one patient on our channel to talk about their experience, and I'm really glad you're able to come here. I do want to ask you, unrelated to everything we just talked about, but you did mention about travel. So what are your plans? Like now you mentioned, like, things are looking better. Are you allowed to like travel? Like I'm not sure if you even.
Yeah. I still travel frequently to Nashville to continue my ongoing care. I'm gonna be doing that for 15 years. So I do that type of traveling, and then now that I have kids, we're going on vacation. President's Day, which was what 2 or 3 weekends ago, we went to Hilton Head. Took my son to the beach, and he was playing with sand for the first time. We took the twins. Yeah, we're doing a lot of traveling, and just like this next stages of our lives, we're really looking forward to just enjoying, because like I said, we've really suffered. So we want to make up for lost time that we didn't get to do, all the nights spent in hospitals. We're making up. Unfortunately, COVID has kind of limited us a bit. We've been wanting to do more since I got the transplant. But now things are open up. Like I said, we're planning to make a trip to Merseyside in Liverpool in the summer. We've been married for 10 years, so we're planning a trip to Paris to renew our vows. Just really cool stuff like that.
I was planning to go to Paris too sometime soon. I was planning to go to Paris with my partner as well. We were thinking about going to Paris, so that would be amazing. I'm really excited, man. Like, so we're lifting those restrictions up. And are you going back to Nigeria or?
Ooh. I always like, it's so funny. I always like the best time to go back to Nigeria is always in December during the Christmas period. That's when, families, that everyone, that lives abroad comes back. And I always say, oh, it's this December, I'm going to come back. And I never go. But now that we have children, I'm sure we're going to make a trip soon, because the grandparents would want to, carry their grandkids, and my parents come here quite often. So, but still, I also want them to see part of where dad grew up. So eventually, pretty soon here, we're going to make a trip there.
That's amazing. And I was thinking at some point, not obviously anytime soon, because I have other plans, but at some point I would love to go to Nigeria for other reasons that just the land and because I know they're having a big push with Bitcoin and with everything around there. So I wanted to
big tech industry there.
Do you want to talk about that? Like, just quickly, like
I can talk. My sister is actually she's the co-founder and VP of basically the Airbnb of Africa. So wow. It's big. Yeah, it's huge. So many. I'm sure you heard of Paystack.
Yeah. And I know Jack
acquired.
Yeah, Jack Dorsey. I'm pretty sure he went to Nigeria.
And Mark Zuckerberg as well. He went.
That's amazing.
They set up a really good accelerator there, man. The tech companies that are coming out of there is unreal. Also because that market is untapped. So basically, you can take a startup idea here that's worked and just basically go create it in Africa. Of course, you're going to need the right skill set to do it, to execute. But that's basically what people are doing. Hey, Stripe is killing it. Let me make my own Stripe here in Africa. E-commerce is still a baby there. Literally, it's still a baby.
Yeah, technology in Nigeria, I know it's picking up. It's been a hot topic. I think before the pandemic, I remember Bloomberg was covering it, Bloomberg Technology. I remember this when Jack Dorsey went there. Yeah, this conference. I don't remember what it was, but he was speaking out. There was some individuals there asking good questions, and it just felt like there was going to be a huge push. The pandemic hit. I have no idea what happened since the pandemic. I haven't really covered. I haven't really seen much the news in Nigeria since then, but I do remember there was a lot of hype before the pandemic, and I'm sure today there is. Right, you're just mentioning it. I'm really it's amazing.
Techstars, my sister's company, Techstars, actually incubated them, and Techstars is a big player there now, bringing a lot of companies and incubating them and introducing them to the Western market as well as the country itself.
And so before we start to wrap up like the interview, I do want to ask you about your e-commerce side of things. I know you briefly covered it. You said you still go on trips for it, and you're still obviously working for it. You have a lot more energy due to everything we just talked about for it. Can you just like briefly talk about your e-commerce side of things? What can you tell us? Like, what is your daily like task with all of that? Like, and how are you doing it in that side of the business?
So unfortunately, like I said, privilege. My parents were business owners, mom and dad. And when I realized that I was not going to be able to hold a job because of how sick I was getting, I'm like, man, there's no way anyone's gonna hire you, kid. You better find something to do on your own. And I'm fortunate. My wife's actually one of the best project managers. And actually, that's actually limiting her, calling her a project manager, but that's one of our skill sets. And she's a really good planner and organizer. And I remember we sat down like, hey, man, you're not going to be able to hold on a job. So you have to figure out a way to, employ, create a job where you don't need someone else. And that's when I decided to go into e-commerce. I've always been into tech as a kid. I remember going to coding school, teaching the teachers how to code, use HTML, which was bad, by the way. They were so mad at me for doing that.
It's HTML, CSS,
yeah. I never kept up with it. So I'm not an engineer at all or a coder at all. I just knew the basic stuff as a kid. So I've always been into tech. And of course, having sickle cell, the only thing I could do was either play games or be on the computer. So I've always been fascinated by it. And I actually started, I consider myself a writer. So I started this website called baggerwriter.com, where it was a marketplace for writers, freelance writers. I remember back in the day, there used to be sites, and I think they still exist, like Guru, freelancer.com, People Per Hour, all these sites.
I think Fiverr offers
Fiverr,
something.
yeah. And I wanted to make a living as a writer. So I went on these sites to find jobs, but there was this race to the bottom mentality where the job poster only wanted to get the cheapest writer. And as an American writer, there was no way I could make a living, getting paid $5 for an article. So I decided to start a company called baggerwriter.com, which was a freelance marketplace specifically for writers in the US or in the Western world that I had vetted myself. And it did quite well and it ended up getting acquired. And it got acquired. I'm like, oh my God, this is pretty cool. I can build something and someone can, reach out to me via email. Like, hey, I was Googling writers and your site came up. So I want to buy it, and they ended up buying it. I'm like, yo, I am never going to work in a physical, this is what I'm going to do for the rest of my life. So after I sold Bagger Writer, a week or two, I didn't know what to do. So I just was working at a co-working space, trying to help other people build marketplaces and eventually sell it off, basically a small digital agency. And this guy walks in with like the coolest business card holder I've ever seen in my life. It's so sick. It was a business card, but it was sick. I'm like, I was like, did you make this? He was like, yeah, I made it. I'm like, where is it? They're like, oh, we predominantly sell these in China, but yeah, my friend David, he makes it. I'm like, okay. And you don't sell this in the US at all? He's like, nope, we never sell it. All right, I want to start selling this product. And that's how I got into e-commerce. Like, okay, I'll connect you with the manufacturer. And he connected with me with the manufacturer. I started my first e-commerce company called Geek Cook. And we just, we started the company with, in tandem with another company, a bigger e-commerce company at the time. I'm not sure if you've heard of them. They're called fab.com.
Yeah.
So I got an introduction to someone at Fab, and because the product was cool and Fab, that was all they were about, cool, unique products. And yeah, we can sell these, and that's how I got into e-commerce. At first, I wanted to make it a direct-to-consumer site where people will come and buy directly from our e-commerce site. But man, Google ads are expensive. They wanted me to spend about $10K a day on ads, and there was no.
Are you serious? 10K?
10K a day. In order to generate the amount of sales to keep the business afloat. So I quickly switched, like, there's no way I want to learn this right now because I'm still dealing with sickle cell. There's no way I'm going to be able to afford 10K a day on ads in order to keep this site going. So I quickly switched from B2C to B2B. I'm like, I'm just going to sell my products to other bigger e-commerce sites like Fab, Zulily, and that's literally how we started. So I've been doing that forever. And that's actually how I got into the consulting position I'm in with a company called Stack Commerce right now. They do the same thing. They create e-commerce solutions for publishers, anyone with an audience. So CNN, Mashable, TMZ, we create their e-commerce sites and we sell our products. We sell vendor products on those sites. So because I was selling my product already on that side, we had a conversation. Hey, I don't mind coming in and being an inside merchant for you guys. So that was obviously post-transplant when we had that conversation. So
Right.
I'm doing those two things now. I'm continuing to run my e-commerce business as a B2B. We're continuing to sell on other marketplaces, Woot, Zulily, Touch of Modern, and then I also do the consulting for Stack Commerce.
Tech commerce. Wow, that's pretty amazing, Jimmy. Wow, so you're basically an entrepreneur. Cool. Yeah, you're like
I like it. Yeah, it's fun.
And you're never gonna see yourself working for somebody ever again, right? Like in a corporate structure.
Not in a corporate. Yeah, not in a corporate structure. Of course, in a way, with Stack Commerce, I kind of work. I mean, they pay me to work for them, but it's not a corporate structure. It's more like I'm a consultant, and obviously, just get your work done and do what you want with your time.
Yeah, absolutely. Yeah, I've actually mentioned this in our channel as well, like the whole idea for like entrepreneurship and I mean, everything we do here in our channel, like on YouTube, it's literally that, right? Being a creator, building. There's no one telling me what to do, right? I just build material for the community, and there's many of us doing something similar. Some are doing it on YouTube, some are doing it on Twitter, some are doing it on podcast side of Spotify. There's a bunch of creators out there, and just there's something novel to that, right? Building your own thing, like you mentioned, right? You built your own craft, and then it got acquired, and you're like, damn, like this is pretty cool, right? Yeah, the feeling has to be amazing, right? It's
and I think when that feeling, I just wanted to like keep on doing it. You know, I'm like, oh, I want to experience this again, and you know, solve another problem. You know, that was a problem I solved back then, was that I felt like there was no marketplace for writers that, you know, actually wanted to write and live here. That, you know, I completely get, you know, people wanting to outsource, you know, and pay to get writing, but for writing, it's hard, you know, and if you want to make a living as a writer here in the US, it's impossible to compete with, you know, with everyone else on the marketplace.
Absolutely.
So I was just like obsessed with, oh, I want to solve more problems, and hopefully someone will acquire it. Unfortunately, no one has acquired my e-commerce company yet. E-commerce is so much harder, I realized, and you know, because there's so much more logistics to it. There's product. Bagger Writer was pure software, you know, just pure this. We have to worry about supply chain. We have to make sure there's product, there's warehouse, pack and pick, all these other crazy stuff. So it's a harder business, but it's a business I love.
That business you're talking about right now that obviously hasn't been acquired, how big is it, like employee wise? Is there a team behind this?
Yes, absolutely. That's the only way I'll make it work is with the team, because my time mostly these days is spent with my family. You know, like I said, I wake up quite early in the morning. I handle work, Stack Commerce, Geek Supply. Those are the two companies I work from like 4:30 to like 8 or 9 or 10. And then after that, I'm with the kids all day. Then I take meetings. I do a lot of meetings to get other vendors on the platform. And that's what usually my days are filled with, is taking meetings, meeting with vendors, partnerships. Have you ever heard of a company called Mischief?
I have not.
Big company. But anyway, so I'm working with vendors in the day, and then by 5 I'm done working on, you know, off to making sure the kids are in bed, or, you know, it's starting their bedtime routine. And then I'm in bed by 9:30, 10, and I wake up the next morning and do it all over again.
That's it. The grind goes on. That's amazing.
The grind goes on. Yeah, and you gotta love it. You know, I love the grind. So I feel so fortunate that I'm able to do it.
That's amazing, Jimmy. That's amazing. So just to close out, a quick last question is, what would you tell people watching this video and going back to like disease / CRISPR / sickle disease? How would you describe your experience so far, like in a very condensed sense? Like, how would you, and if someone was to ask you, you know, how would you describe your last like 1 year, 1.5, 2 years? How would you describe it?
Miraculous. That's literally what it feels like, a miracle. But to condense everything, my whole life, starting and having a pretty tough life with sickle cell, and to now where things are a lot easier. One thing that I will summarize and let everyone know is, and it sounds so cliche, but it's so true. It's so true. You know, what a man thinketh, you know, so is he. You know, when I was sick a lot, in the hospital a lot, I was a pretty dark person. You know, always dark thoughts, and it manifested in my life. I was getting sick a lot. And then, like I said, my wife and me growing up, maturing, my mom being a woman of faith and kept on preaching the good word to me, I started becoming more positive. And I realized when I became a more positive person, my life actually became more positive. So I know it's cliche, but it works.
It works, absolutely. So where would someone be able to reach out to you, Jimi? Like if someone wants to just ask you a question or just talk to you really quickly, or just, you know.
Twitter will be the easiest way. I tend to stay off social media, but the only social media, I hate Facebook, I hate Instagram. But the only social media platform I love is Twitter. It's just so great. So
Twitter community is amazing. Yeah. Twitter community is amazing. Like it's changed my life, and I'm sure it's changed your life as well in some sense. Yeah. So
I have like really close friends that I've never met that I've made friends with on Twitter.
Absolutely. Yeah. And it's going to go on, right? The community is going to grow and we're going to get a lot done. We have so much work to do. But what we just talked about, Jimi, is just amazing. You're not just a family man, but an entrepreneur. And the fact that you are now feeling better due to everything that you went through the treatment is allowing you to be more productive, more efficient, and allowing you to live a life, to actually live a life potentially pain-free. We'll see how it goes, but it's amazing, man. So thank you so much for joining, Jimi. I'm sure we're gonna have another talk at some point in the future, and I want to talk. I definitely want to talk furthermore about some other topics in the future. So thank you so much, Jimi.
Thank you for having me on.
Thank you very much, everybody, for watching, and we will see each other in the next video. Thank you.